Howdy, folks. Dr. Ben here. We are putting the med in comedy. Today we have very hilarious stand-up professional comedian, Miss Paula Kozinski. And we have board-certified emergency medicine physician and medical toxicologist, Dr. Mike. All right, are you folks ready to play What the Heck? In What the Heck, Dr. Mike here is going to show Miss Paula here some medical terms that doctors use every day, but Paula may or may not have heard. And so Paula's going to pronounce them and tell us what she thinks they mean, what they may be used for. Might be a medicine, a drug, a disease, a condition, a tool, an instrument. All right, anything's fair game here. Are we ready to start?
Oh, I'm ready.
I'm so ready.
All right, what the heck? Dr. Mike, let's give Miss Paula her first word. Let's test her knowledge.
Here's your first word.
All right.
All right. Computed tomography.
Oh, wow. That rolled
Ooh.
off the tongue. What does that mean?
We got a ringer here.
That's right.
All right.
What is I can't even say it. Computed
tomography?
Yeah, what is that?
Well, I think a tomography is a test done. It's a reading of some sort. I'm guessing it's something similar to maybe like an ultrasound or something.
What are the first two letters?
Of each word.
CT. Oh my gosh.
That was a good clue.
That's a good clue.
CT. Do you think that's a clue? CT?
I feel that's a good clue.
Have you heard of that CT?
Sometimes it really is just that simple.
So what is computed tomography, Dr. Mike?
Think about it. It's a lot of X-rays that are put together by the computer in order to give you a three-dimensional image.
Gotcha. Mm-hmm. And sometimes contrast is used.
Yeah, sometimes contrast is used to give our radiology colleagues who are part-time gardeners because they hedge a lot.
Oh, they had, and I think veterinarians, when they use it, they call them CAT scans.
Yeah, absolutely. We got a new one over at one of the hospitals. It's a biologic CAT scanner. Basically, they take a cat and when it meows, it means it found something.
Wow, you guys are very sophisticated. You missed your calling as vets.
Well, yeah.
Yes. Dogs cannot perform MRIs, but cats can.
Yeah, exactly. And when you're looking for cancer, it's a PET scan.
So, listener, you can sound smart by, instead of saying CT, you could say computed tomography. All right, good one.
All right.
Are you ready for the next
Well,
one?
you were
right.
on. It was a test.
Yeah, you got it right.
All right.
I just
Dr. Mike's giving her
overcomplicated that
number.
one.
What the heck? What is this word, Dr. Paula? Sound it out.
Choledocholithiasis.
That's pretty
Wow.
good. That's pretty
Great
good.
pronunciation.
Mm-hmm.
Thanks.
And what is that?
Okay, the only thing I know is choledocol, which is in your bile ducts.
Ooh.
And I know that because I had a cyst recently taken out, and it was called a choledocol cyst. So thiasis, I don't know if that means like I don't think you take it out. Maybe you do take it out?
You need to take it out, yeah.
Oh, yeah, okay.
So chole, like you said, gallbladder, doco in the duct, and lithiasis, lith is a stone.
A stone.
Oh, so it's a stone.
Gallstone.
That's gallstone that's stuck in the duct. That's actually that's an emergency.
Oh, okay.
That's a real emergency.
Gotcha.
And if you hear of nephrolithiasis,
Yeah.
Kidney
stone.
Right.
Okay.
gallstone, kidney
That
stone.
makes sense.
Yeah. Good job on pronouncing it.
Thank you.
Well done.
I literally had a choledocol cyst resection less than 2 years ago. 2 or 3 years ago.
Wow. So
Wow.
you knew what that word was.
Yeah,
Kind
that's
of.
We have
impressive.
to sound smart, so we can't
We
just say gallstones. We have
Yeah.
to.
Well, it describes where it is. So when I need you to take a decode. It's our GI doctor who has, I can't say the next. Maybe it's on here. I don't know. I don't want to say that word.
Okay.
Let's save it here. Let's see.
What is this word?
Ooh.
Dr.
Okay.
Paula, what is this word? Sound it out.
Mm-hmm.
I'm going to go with sphygmomanometer.
Okay. Like the S is silent?
Yeah.
Okay, the S is silent.
And I thought the S was silent. I thought maybe the G was silent.
Okay.
The S is not silent.
Oh, okay. So then sphygmomanometer.
Sphygmomanometer.
Oh, wow. So none of those are
And
silent.
what do you think that
Alright.
is?
Any idea what it is?
What would you guess?
Sphig reminds me of like your sphinx or something.
Your sphincter?
Yeah.
No, it's a good try though.
Yeah, good.
So maybe go with the second words. That might give you a hint.
Mammogram?
Manometer is a pressure, so it's a pressure meter.
And it's not like the pressure in your butthole.
No, not the sphincter pressure.
I'm really
Not the
hung up on
sphincter
that.
pressure.
I think that would be worth knowing what the pressure of your butthole is.
No, this is your standard blood pressure cuff. Whenever you go to the doctor or the paramedic shows up, we call it a BP cuff.
Okay.
That's a hard word to say a lot.
Yeah. I was thinking at least one of those letters
takes
were
your blood
silent,
pressure.
so.
The blood
Takes your blood
pressure
pressure.
cuff
Yeah.
is the sphygmomanometer.
Yeah.
Sphygmomanometer.
Exactly. It just rolls off the tongue.
Yeah.
I like it.
Again, it makes us sound
All right,
really
what
smart.
the heck? All right.
ABC, airway, breathing, circulation. It's the three
ABC.
things that you're supposed to check in an emergency situation, correct?
It's part. Yeah, that's excellent. Yeah, this is what I specialize in, the ABCs.
Because it's like if someone's like unconscious, you're checking their airway, you're checking for breathing, and you're checking if they have a pulse.
Exactly.
Dr. Paula.
There you
All
go.
right.
So first things that we teach a baby trauma surgeon are the ABCs. So airway, breathing, circulation, deformity, exposure, right?
Okay.
So do you know what the second thing we teach a song for baby trauma surgeons? Do you have any
What?
idea? It's the head, shoulders, knees, and toes, right? So head, shoulders, knees, and toes, eyes, ears, mouth, and nose. That's how you do a trauma assessment.
Okay.
Did you know that there is another verse to that song?
Tell us.
It's a Dr. Hyun original. And so it goes chest, belly, back and thighs, back and thighs. Don't forget to check the groin as well as the axilla.
Okay.
Yeah, this is a Hyun original.
I like it.
Yeah,
Beautiful.
Dr. Mike
it goes
original.
well.
Now, the ABCs of anesthesia, that's a little different.
Yeah.
They have to make sure airway is A,
Yeah.
and then they need to make sure they have a book and a chair. Airway, book, chair are the ABCs of anesthesia.
Yeah. Did you know that they we last month was Valentine's Day? Did you know that they write their own Valentine's Day cards?
Anesthesiologist do?
Yes.
No,
yeah,
tell us.
yeah. The first one is "Will you be ketamine?"
Will you be ketamine? Ketamine, listener,
Yes.
is a drug that anesthesiologists
Yeah,
use.
yeah. I propofol for you.
And some people use it recreationally. So
Yes,
there's
do not
that.
They
do
do.
that.
They
Do not
do.
do that.
But yeah, the second one is I propofol for you.
I propofol for you.
All right.
I love it.
Ready for what the heck? What's our next word,
the
Dr.
next
Mike?
word.
Miss Paula?
Ooh,
what is this word? We may.
Okay.
We mentioned this one already today.
Yeah.
This is a toxicology word.
Okay. So
How do you say it?
I think it's N-acetylcysteine.
Well, that was so good.
So
That
good.
was
So close. She was close, wasn't
so
she, Dr.
close.
Mike?
I would, if she said it on the
I'd
phone to me,
accept it.
I would accept it. I know what she's talking
On Jeopardy,
about.
we would
Okay.
accept.
Yeah, I think
And
that's close.
that's the chemical, right, that you use for hang on. That's the one that for benzos. It's like one of the two, isn't it like one of the two things that you use?
In toxicology, so it's benzos and this.
Benzos and that. Okay.
Yeah, so this is the
To treat.
Yeah, this is the Tylenol antidote.
Tylenol. Okay.
Yeah.
This is what Dr. Mike would use if you took too much Tylenol.
Exactly. This is an antidote.
Wait, can you put it back up for a
Yeah,
second?
so it's N-acetylcysteine.
Okay, so acetaminophen, like, is it similar? Is it the ACT, same thing?
No.
Oh, I wasn't sure if it was ACT, like
Yeah,
acetaminophen. and then it
no,
was
but no, it's acetyl. It's just where the groups are.
Okay, gotcha.
So yeah, it's because it helps what the structure looks like
Gotcha.
of the molecule.
Okay.
And what does that do to Tylenol?
So this is a detox. So what it does, it adds a sulfur group to it.
Is
and
it a
helps-
base so it doesn't make it acidic? Is that what
No,
you said?
no,
Oh, I'm
not
sorry.
in this case. Not in
I
this
got too
case.
excited.
No, I know. I love acid bases. Exactly. The acids of bases, acid bases. No, in this particular case, it's a sulfur donor, and it helps the body detoxify the toxic compound. So I was reading the Tylenol chapter the other day, and I got tired, so I took a Napkey, which is the toxic compound. Napkey, that's my tox joke.
Now, how is that administered? N-acetylcysteine.
So it's administered either IV or orally.
okay.
Mm-hmm.
So, but if you drink it, we usually keep it covered because it smells awful because it has a sulfur group. It smells like rotten eggs.
Oh.
It doesn't taste bad, but
it smells.
I don't let people smell it because they're not going to drink it because it smells terrible.
Wow. Okay.
Gotcha.
Smells
Yeah.
like rotten
Yeah,
eggs.
it smells like rotten eggs, but usually we give it through the IV.
Okay.
Okay.
Yeah,
Oh,
one of my
interesting,
favorite
listener.
one of my favorite medicines.
All right, what the heck? Ready for
What's
your
What's
next
the
word,
next
Dr. Paula?
one?
Oh,
Ooh.
naloxone or Narcan.
Oh, boss.
Our
over here.
favorite.
Boss.
That's the one that
Boss.
everybody should know about.
That's
Okay.
right.
We all want to
what is
have
it?
it.
Yeah, tell us what it's for.
It is to reverse a drug overdose related to like narcotics.
Correct.
Wow, Dr.
Well
Paula.
done. Well done. That is correct. So it's a shorter acting opioid antagonist. So it blocks it reverses the opioid agonism. That agonism means stimulation, right?
Okay.
It hits the receptor, so it reverses that. So this is available, and you can save lives with this in the field. It comes in an IV form, and it also comes in an intranasal form. So you can give it. Anybody can give it as a nasal spray. So yeah, very good. It's
cool.
such an important medication.
And you can give it to them in the nasal spray even if they're not breathing.
Right.
Conscious.
Yeah. Yeah. Exactly. Because yes, correct.
If you see a random person passed out on the street and you have access to Narcan, is it better to just give it, no questions asked?
I think it would be safe under the Good Samaritan law.
Okay.
I think that would be if they're not breathing. If they're not breathing, I would give it. If they're breathing, probably don't give it. They're probably just sleeping. Then you'll get
sleeping.
I went to break into people's homes
They assaulted me with this nasal spray. This random woman
in the park.
in the park.
But it's fairly safe, right? As far as
as long
side
as
effects.
so yeah, it's safe. If you have narcotics on board, if you're chronically taking pain medications and you have not had an overdose, and you give that, they're going to have a very bad day. You're going to reverse their therapeutic.
They're going to start hurting.
They're going to start hurting and vomiting. It's not a good day.
Okay, all right.
But you're probably not going to kill anybody.
All right.
All right,
can
what
save
the
one.
heck?
Yeah.
Dr. Paula's doing great.
Nobody
She's doing
dies.
great.
What else do we have here?
Okay.
Dr. Paula, what is this word?
Okay, I'm going to say it slowly. Dichlorodiphenotrichloro.
You're so close.
What did I
So
miss?
it's dichloryl, diphenyl, trichlorate.
Okay, so
What is that?
dichloral, 2 chloral something,
Mhm.
2 phenyl something, 3 is that the measurements or whatever?
So, are you making a cake here? That's what it sounds like. 2 measures of chloro.
A recipe.
Like
It's
two,
a recipe for-
two of the other chemicals and 3 of the last chemicals.
What is it? Like a instrument or medicine or disease or what is this?
You don't know?
I was asking Dr. Paula.
I
I don't know.
I got to look this one up.
If you're asking me, it seems like a chemical. Of some
It is a
sort.
chemical, absolutely
Okay.
chemical. I'm not sure what the more generic name is for
Yeah.
it.
Okay. This one's it's a stumper.
Yeah, I gotta look this one up.
This one is related somewhat to toxicology. It's abbreviated DDT.
Oh, this is just DDT.
So
Okay,
it's pesticide.
Yeah.
Do you ever see any pesticide toxicities?
Oh yeah, I love
That's
pesticide
DDT?
toxicity. Yeah, DDT. It's that's why I was looking. I'm like, what are the letters that this is probably doing?
Tell us about DDT or pesticides.
Yeah, DDT is an anti-malarial. It's very important. So it kills off a lot of the mosquitoes and help knock down malaria all around the world. They're very effective, very cheap. The reason we don't see it anymore is it's been dangerous to wildlife, specifically makes eggshells of certain birds very brittle.
Okay.
So it's very persistent, but it has been credited with saving literally millions of lives all over the world, preventing
Is
malaria.
that the same as what people say DEET?
No, DEET is different. That's just
Okay.
for local mosquitoes.
Mosquito.
This is DDT. This is used for a country level.
Okay.
That's a great question.
Okay.
Dr.
Yeah.
Paula, what animal do you think kills more people worldwide every year? What animal?
I would say probably either ticks, mosquitoes, or dogs.
I would say humans.
There's always going to be one guy.
I think it is the mosquito, though.
Mosquito,
Yeah.
It kills a lot of people, a lot of arboreal viruses.
Okay.
Yeah.
Makes sense.
Mosquitoes are
They're
terrible.
really bad in northern Minnesota.
The mosquitoes?
Yeah.
Really?
Hopefully they don't have malaria.
I'm being so serious. Like northern Minnesota has some of the worst. Like the mosquitoes are so bad. The ticks are so bad. There's nothing like poisonous in that sense, but you just can get all those tick-borne and mosquito diseases. Probably not malaria, but like I had a friend who got West Nile.
Oh, wow.
Wow.
Dengue, West Nile.
I think the Duluth Chamber of Commerce just unsubscribed from my podcast.
Oh, wow.
Fix your problem.
Wow. That one was a little blood-sucking right there, wasn't it?
All right, what the heck? Ready for number
The last one.
last one? What does
Okay.
this mean?
Ooh.
Oh, I know what this means.
Ooh.
NPO
Mhm.
means as needed or by mouth. I can't remember.
Okay.
Nil.
Nil.
What?
It says nil.
Per os.
Oh, I thought you were saying nil as in no. Okay, no peros.
Per
Okay.
os.
Okay. Yeah.
Peros. No peros.
Yeah. So try it again. What do you think that means?
No peros.
What do you think it means?
Oh. No, I've heard this before.
Yeah.
I think it either means by mouth or as needed.
It is by mouth, but what by mouth?
The medication is by mouth.
Nothing by mouth.
Nil.
No, Neil, you said no.
Nothing by mouth.
Nothing by
that one,
mouth.
like, actually kind of pisses me off because I knew that. I so knew that.
Oh, you knew it by mouth. You did
Like-
great there.
Yeah, but that's not, I didn't get
Before
it right.
surgery,
and
you
all
have
know
to
it.
be
Nothing
That
by
would not
mouth.
be
Yo.
accepted on a test question. I would have gotten that wrong.
Yeah, you would have gotten that one wrong. But this is like the main, this is going to prevent you from getting your surgery.
Yeah.
Like the
Can't
first
eat or
question.
drink.
The first question.
but-
Nothing by mouth.
The
Yeah.
thing is, I know what I like when they write on your stupid board
NPO.
NPO, you can't have anything, and you like gotta beg them for ice chips, and they give you this little sponge with water.
Did
on
I
it.
salt the ice chips? Make them
No,
tasty.
they should do that.
We're not trying to be mean. It just saves your life.
Yeah, exactly. Yeah, exactly.
If contents from your stomach go into your lungs, that
Yeah.
could be potentially fatal. So,
Yeah. Our anesthesiology colleagues appreciate not having to deal with a bad airway.
NPO, nothing by mouth.
I don't get that. I don't get that benefit in the emergency room. I'm like, patient needs an airway. It's like, well, have you fasted for the last 6 hours? I'm not going to put that airway.
I've
I
had
don't get that.
patients, they say, well, you said I couldn't eat or drink anything, and they have like a big dip in their mouth or something.
Oh no!
So don't eat or drink anything when they tell
Why
you.
don't they let
Nothing
you
by
paint
mouth.
your nails?
They don't let you paint your nails.
If you get surgery, you can't have your nails painted.
Because they need to do the pulse ox. So the machine that's used is
They put a sensor on
yeah.
there.
And
So can I just paint not one nail? Like, can you just tell me in advance which nail you're? Because this is like truly when you go in for surgery, it's
Don't paint
so
your
like
nails.
you just don't get anything. It can be like really dehumanizing. So to be able to do something silly like paint your nails or something, you feel a little more like human.
Buzzkills. Can't eat or drink. Can't paint your nails.
she's getting anesthesia. She'll have plenty of a buzz.
I love it. All right, listener, what the heck?